So hi Nitish, how are you?
I'm good, Dr. Shah.
So Nitish, we did your transplant around 6 months back,
6 months back.
and
Yes.
you live in US, huh?
Yes.
So you were like leaving for New Jersey
in a couple of weeks.
in a
from
couple
now.
of weeks when we did the surgery.
Yes.
By the way, how does the growth look like? And
Looks amazing. It's pretty natural. So a lot of people have complimented me. So,
you got compliments.
yes. People who knew that I had gone in for a transplant,
Mm.
they're complimenting me on it.
Mm.
And the others, they cannot even make out that I had a transplant.
But does somebody ask you like you have changed your hairstyle or hairstylist?
Yeah, I mean, I just give credit to vitamins that I'm taking. So,
You don't tell them
Yeah.
you are a
most of
transplant.
the people I don't. People who know me well, I obviously tell them.
Yeah. In fact, see, when I did my transplant and my hair have also come up very nice. I play tennis and I go to different clubs. You also play tennis.
Yeah, I play tennis.
We'll play together when like
Absolutely, absolutely, most welcome.
So when I went to to play tournaments, we go to different clubs. So when I went there, many people they were looking at me, my hair, and they could not recognize that I've got a transplant done. They were just amazed to see. They said you have changed your hairstyle and it looks very nice, and you look very young.
Exactly.
So, but they could not trace that I got a transplant done. So now the growth has started post shedding phase, and it will improve in next 2-3 months. So you'll see this improving further. So in the pictures you can see you had thinning in this portion, and the area of your the frontal area, it was quite thinned out. The temples were not there, so the crown. So when we did the transplant, we did a combo of FUT and FUE for you.
Yes.
And it was a 2-day procedure.
Yes.
Where we did 1200 FUE on day 1 and 2800 FUT day 2. So this was the area where we did your FUT, the crown portion, and the frontal area we did your FUE. So quite a big area, the temples, because it was kind of receded, which we covered both the sides, and we did this hairline thing. It looks pretty good. Any pain or something like you after getting the transplant? Maybe a couple of weeks you fly to US.
Yes,
So,
there was no pain as such. I was anticipating certain kind of pain, but that never happened. And you had given me antibiotics and painkiller, and I took them, but it never pained.
good. So what all medications are you on?
I use minoxidil every alternate day. That's once.
One application.
One
so
application.
3 to 4 applications per week.
If that,
5%.
yeah, probably three
Applications.
applications per week. No other medicines, except for the vitamins that.
Hair art kit which I gave you that.
Yes.
So no finasteride.
No finasteride.
So I think we discussed it beforehand also when we planned for surgery. The reason why I did not start finasteride.
Right.
So your age is 41,
41.
and see at this age, if you are holding up that many hair, that's pretty good. So the probability of losing hair at a rapid pace is not there. Had you been say just 20-21 years of age and having that grade of baldness, then it would have been more important, the sustenance part, and maybe more aggressive sustenance we would have required.
Right.
So there are options. We know the medicines also. There are two problems which we discuss with medicine: dependence and tolerance.
Exactly.
So that means when you start using any medicine, you become dependent on that. So you cannot stop. So once I start finasteride, obviously we won't be able to stop it. And second is tolerance. So every medicine comes with a shelf life. Suppose if we keep on using it for a long period of time because you can't stop, so after some time your body may just stop responding to it, and then even if you are using it, you may notice that gradually hair is thinning out and the baldness is increasing. Another reason why I didn't start finasteride on day 1 is many times, because the hair loss is at your age. At times it is like kind of stable or very slowly progressive. So if I start this, then lesser medicines won't work because your body gets used to this one. Okay.
And we discussed this.
Yeah.
Same thing with minoxidil as well. You told me
Exactly.
that. So that's the reason I'm using 5% minoxidil every alternate day
Yes.
and one application as
Yeah.
well. So
Generally, people give it twice a day, and that means 14 applications a week. So we are just using like 3 applications a week, which again gives us an option to step up the dosage later on if we need to. Because
basically prolong the lifespan.
exactly. Now, in case we notice that sustenance is not possible on minoxidil, and we notice that there is some gradual thinning which is going on even with minoxidil, in that situation we might need to add finasteride. So, and that too. See, one important fact is the timing at which we introduce the medicine, because I'm buying some time through this minoxidil, and whatever time I buy with this, that's a bonus. So maybe after some time, when you get tolerant to this, I can add finasteride. So I would love to buy separate timing with a separate medicine, rather than putting them all, clubbing them all together. Now, second thing is after timing is the dosage. So similarly, like the way we are doing it in minoxidil's case, finasteride usually people are prescribed 1 mg per day. So that's a huge dose. There are studies which show clearly that even at low doses like 0.2, 0.25 mg, it works. So when I give this to my patients, I usually start this at a very low dose, which leaves us as an option to increase it, which reduces the side effect profile of the medicine. So that again is important, very important. Now it improves the areas where we didn't do any transplant. This portion. So this portion right now, we know the picture. We did not place grafts in this portion. We did the crown, we did the front, and to some extent this portion. Now this portion improves significantly if I give finasteride. Number one, the density and the coverage. So the entire scalp looks fuller. I call finasteride oral topic. It's an oral fiber which you take. Guys, please listen to this. Finasteride is an oral topic because, like hair fiber, it makes the entire thing black, and it's like a black carpet everywhere. So you don't see through the hair, you don't see the skin, and it looks very dense. And the hair also become thicker. Second thing, what finasteride does, it actually increases the thickness of your transplanted hair also. But again, all these benefits are temporary. When you stop this, they reverse. And sometimes the withdrawal is so severe that and see, your eyes also get used to see that thicker bouncy thing. So when it is gone, it looks really bad. So so the transplanted hair also becomes thicker. Thirdly, there are miniaturized hair which are present in this portion, and these miniaturized hair improve when we give finasteride. So the hairline, the miniature, if suppose there are some softer hair between the transplanted hair, it gives a more aesthetic value to the result. So when you see the results on internet and see all this, you will find that the beauty of result is enhanced when finasteride is added. But yes, if somebody can give you that beautiful hairline which is kind of undetectable without the help of finasteride, that means that, that speaks volumes for the thing which has been done. So now we again have decided not to start finasteride as of now. Let's wait, let's see how things turn up. The result which you are seeing right now can be made like to look 2 times or 3 times better and thicker. Sometimes patients say, doctor, see, in that case which you showed, that area is little vacant, this area is empty. So I take all that without any complaint, because I think for every surgeon, patient's well-being should be of utmost importance. True. Because anything which can continue or carry on with, we can carry on without something, it's great. And many of you may not need finasteride at all. So just introducing any medicine which may have some potential side effects to your body does not make any sense. But yes, this is a relationship based on trust between patient and doctor. Absolutely. So when I'm suggesting you not to take this, that means I'm taking the responsibility. I know you won't be able to differentiate between transplanted hair and finasteride hair. So you'll be very happy. I mean, if you see that, you'll be very happy. You'll say, "Oh wow, what is?" I mean, you can't imagine what finasteride can do. But the thing is, sometimes I when I watch people giving testimonials for different clinics, sometimes they are so happy, but unfortunately they don't know
The side effects.
yes, not just the side effects.
In the
Sometimes
long-
they think that these are transplanted hair which the doctor has grown, but they are not all transplanted hair. They will go away as
Take away finasteride.
yes, or the finasteride stops working on you. So many a times, like these patients are being told that you need this medicine for 6 months, you need this medicine for 1 year. Afterwards, you can stop, or maybe we'll taper it off, or your baldness gene will get switched off, or all that blah blah blah. But the thing is, this guy does not know what will happen when entire thing is gone. So but the thing is, see, it took 2 days to do 4,000 grafts,
Right.
and it took 2 methods to do 4,000 grafts from the scalp. But there are people who do 5,000, 6,000 from scalp alone by FUE. There are people who do that many by just FUT alone. Now it is not possible. You may say the number, but just by saying, you don't get it in hand. Okay, so if you don't have it in hand, you can't place. So when the surgeon or the clinic knows that they are not doing the sufficient number, because they are not competent or confident doing both the techniques, they cannot do the number, they cannot get the number. So if they don't get the number, they can't place. They know that the patient won't be happy, and the patient will be like after us, that you did not do this, you did not do that. So they have to take the help of finasteride. So finasteride is such a big rescue for the clinics, for this. That's why I see the guy who cuts my hair in salon, he has now opened his transplant center, and even he knows that finasteride must be given to every patient post transplant.
And that's what I appreciate about you, Dr. Shah, because at the very outset you told me, explain all this stuff to me. So and we made an informed decision that I will not be taking finasteride, and I'm happy with my results right now. And like you said, it's only been 6 months,
Yes.
so the results will continue.
Yes. Now, you know what? A person who is bald, who is looking for hair restoration, he wants 3 things. First, density. Second, coverage. And third, good, nice looking hairline. But they don't know when they are scanning the results, when they are trying to choose a clinic or zero down to a surgeon. They don't know what part surgeon has played and what part medicine has played. If the surgeon is honest, if the surgeon is true, and he has actually done the right work, then in that situation, surgeon won't be afraid to maybe hold back the medicine. But if the surgeon has fear, if the clinic has fear, oh, I don't know, because once that image is created, 6 months, 7 months, when you see your head full of hair, you are happy with the surgeon, you are not going to blame him. Now the surgeon has saved his neck.
Exactly. But he hasn't told you the long-term effects. Once the medicine gets taken away,
Yes.
that has
So unfortunately, a lot of people don't know. Unfortunately, a lot of people who have high grades of baldness, grade 6, grade 7, they think that the entire thing can be covered with the FUE method alone, which is not possible. So all these things are important, and I think you should pay attention to this in case you are planning for a hair transplant surgery. And I really thank Nitish for taking out time and sharing the experience.
pleasure is all mine. Thank you so much.
Thank you. And when I come there, we'll play together.
Absolutely. I mean, I'll get back in form because I know you are a good tennis player.
Yeah. I'm daily improving. I take coaching and everything, and I'm improving my. See, another thing, like life is about learning new things, and life is about uh, getting in focus. Like everything you do, you should be so much focused that you should not leave any leaf unturned.
Right, exactly. Exactly.
So when I play flute or when I play any musical instrument, these days what I'm noticing that the skill is improving because my focus has improved so much.
Totally engrossed in it.
Yes, and the same thing is happening in tennis. When I play my shots, today only I was working on my forehand and backhand and the whip.
Right.
So how easy and comfortable you can hit the shot and in your zone, like in your striking zone, not away from your body. Otherwise, you
Close to
are
your body.
yes.
Exactly.
And thirdly, the same thing is happening with transplants also. When we are doing every neck surgery which we are doing
Getting
is
better.
way better than what we did yesterday. So every single day we improve, we are improving, and it is showing up. Your work is wonderful, but yes, had I done it today, I would have done it even better.
Feeling a bit jealous now.
No, that's okay. I did mine also 9 months back.
Nobody can make out that you had a transplant.
Yeah, it looks actually so stunning and so beautiful.
Right, exactly.
Yeah,
Exactly.
so I'm happy. I'm happy. Both of us are happy.
Yeah, exactly. Absolutely.
Thank you. And yes, so correct donor assessment is so important. One should pay attention to all these minor facts. And believe me, not all doctors are going to tell you about these things because not every doctor is Dr. Shaili Gupta.
And if I may add, anybody who has any doubts, I mean, they can go to your YouTube channel and watch all the videos.
You also,
Exactly that. You came recommended from a very dependable friend, and then he asked me to check out your videos, and I watched almost all of your videos before coming here.
okay.
So, and I was pretty happy that I came here. So,
Yeah.
so because you clear all the doubts hair transplant candidate might have in their mind. So,
And thank you. You are contributing to those videos now.
Absolutely.
And, my pleasure. Thank you so much.
most welcome.
Please take care. We take a look at the hairline which we made. So hair are obviously still growing, and the hairline looks so natural, so natural. It looks very beautiful. See the fine work which has been done on the hairline. It looks very dense. Now the thing is, this is 6 months result, and it is going to improve further. And if we take a look at the temples, this also has come up nicely. On the other side also, if we see, it has come up nicely. Now we have not given finasteride, obviously, which could have made this portion very thick, and the fine work which we are noticing at the hairline zone would have looked even more fine and beautiful with addition of finasteride, because there are miniaturized hair in this area as well, which can improve on finasteride and which can make the hairline look even more dense and natural. So if we can give you this density and the hairline aesthetics without finasteride, then that means the work is good. This is the crown area. Up please. Now these hair are improved. I mean, this is the area which we transplanted, and the hair are coming now. They grow in length. They give you coverage. This portion which we did not do, this portion over here. So suppose if we had taken finasteride, this entire thing would have been covered so nicely. And when you see patients where comb doesn't go and they do this and that, there are two things which you should always look for. One, the pre-pictures, mostly when you see, you will see head shaved off. So that also creates an illusion that the result is very good and very nice, and a lot of things have been done because the comparison is with shaved off head. Secondly, finasteride, which is so important, so which can make it look so dense that you can't even imagine. Okay, so if at all somebody needs finasteride, I think either you start it before the transplant. Many of you might not need a transplant because I have seen many patients which if I put on finasteride, the area improves so much so that patients think that, okay, doctor, now there is no need of transplant. Tata, bye bye, go. I'm going. So discuss this with your doctor. Ask them what is your plan post transplant. how are you going to sustain my growth? And if they say, I'll give you finasteride 1 mg per day daily, immediately post transplant, maybe you can try this one formula which I just mentioned. Or the other is like you get the things done, see what kind of growth is coming. Even if you and your doctor plan to take finasteride to improve the growth, don't worry. After 6 months, after 8 months, also, if you add, it will work. It is not like that you have to start it in immediately after transplant. This immediate after transplant business is good for the clinic. It good for their sales. It is good for showing things up. It is good for befooling you also, but it is definitely not good for you. Okay, if I'm doing 100 cases, 100 transplants, and out of those 100 I give this medicine, all 100 patients I give the medicine, I think then there is no point discussing things with your doctor, because everything is pre-decided. In Mr. X, Mr. Y, Mr. Z, everything is pre-decided. Okay, we have to start this. No, not everyone is similar. Age is different. Donor is different. Their past track record to medication response is different. Everything is different. So how can the treatment plan be same for everyone? Not possible. Not possible. So please take care of all these things. These are very important minor things which you must know. Thank you.